Okay. Welcome everyone to the webinar on SIT flow diagram, potential and opportunities for achieving sustainable citywide sanitation. This webinar is a part of our online training on SIT flow diagram, which is being held from 11th today to 21st of July. Before going forward, I would like to take you through some introduction of CSC. First, can you please? Yeah. So CSC is a public research organization which was set up in 1980s, and it is working towards bridging the gap between information and knowledge. CSC has been awarded with the Stockholm Water Prize in 2005 and India got Indira Gandhi Prize for Peace and Disarmament and Development in 2018, and also Edinburgh Medal in 2022. CSC basically works on 4 themes: action research, advocacy, capacity development, and cross learning. A water program at CSC, we work on water as well as wastewater issues. Next, please. Next. So in these 4 verticals, we work on different issues, different themes like air pollution, climate change, industrial pollution, water, solid waste management. Yeah. So that we can proceed here. CSC has been set up one state-of-the-art institutes also, where we conduct regular residential trainings, workshops, etc. And yeah, next. So today's webinar's agenda is we have with us and speakers Arne Panesar from GIZ, Alexandra from GIZ, Vikas Agarwal from RSTPL, Paresh Chajed, moderator of Sujana, Sarim Ansari, who will share CSC's SFD journey in Uttar Pradesh, and my colleague Harsh Yadava from CSC will be moderating this session. We have with us our program director, Ravinder Kapoor, sir. So next, please. Okay, so now I'm handing over it to my colleague Harsh Yadava for the insights on SFD. Yeah.
I welcome you all. Hello everyone. I'm Harsh Yadava. So before proceeding forward, let's just understand that why we are doing this webinar. The basic reason behind it is to orient the participants joining for the ongoing training, and also to the other participants to tell them about like what was the vision behind the development of SFDs, how SFDs have been applied so far, and what we have learned from them, and also some case examples straight from the ground that can tell you that how SFDs were fruitful in bringing change onto the ground and bring understanding and how we can measure the sanitation change in cities, in states, and in the country. Before proceeding forward, just a small understanding like what is exactly SFD. So it's a pictorial diagram, a graphic that helps, a tool that helps you to really understand and communicate how excreta physically flows through the city. Or in simple words, it also tells you the fate of excreta, how it is being managed in the city along with wastewater. It is a tool for planners and architects, normal enthusiasts who wants to work on sanitation, who wants to see the change on the ground. A tool for engineers, decision makers. How it tells you the fate of excreta in the manner that how much population is associated with certain kind of management of excreta and wastewater in the city. It is a representation of public health hazard, and it helps you to develop an understanding that where to set priorities when you want to invest, when you want to do interventions in the management of sanitation in the city. Also, we also want to make clear that what it is not. It is also not based on actual volumes. It is a representation of public health hazard, but not exactly the risk. And it is also not a precise scientific analytical tool. Before proceeding forward, I would like to explain that how it all began, how CSC entered into this. It all started in 2014 when CSE partnered with the group of organizations who were lead in excreta management and joined hands with World Bank. From there we started field testing of SFD when phase 1 started, and we developed SFD reports for around 11 to 10 towns. And then in 2015-19, we had this phase 2 of SFD initiative, where we also made SFDs worldwide and even in India. And then there was phase 3 of SFD, where the major task was to capacity building of enthusiasts and the decision makers to make them understand how to make SFDs, to do sensitization workshops and training of stakeholders. These were few SFDs which we made during the SFD phase 3. How it has helped us, let me just explain you in this way. So when we made an SFD of Delhi, it helped us to understand that 30% of the city is dependent on on-site sanitation system. The report helped us to, enlighten National Green Tribunal Committee, that is NGT, to make a committee on pollution of River Yamuna. The findings of SFD 2016 helped to register more than 300 private desalers and initiating the practice of co-treatment, that is treating fecal sludge and septic along with the municipal sewage in the STPs, and free installation of septic tanks, etc. Few learnings which I want to tell, that when we were making SFDs, when we were developing SFDs, what it helped us out. So we kind of practiced, we kind of tried the SFDs on the field, and we brought some feedback and then helped it improving as a tool. So we understood that in India we have a lot of non-availability of data. Data is also not current. Data is outdated. There is limited form of data. We have also a condition that there are some areas in the city, in the country, or some regions in the country where sewer line is present, but STP is not present, or STP is present but household connections are not there, or maybe STP is there but all the wastewater in the STP is coming through open drains or tapping of open drains. Effluent coming from the septic tanks is never measured or not taken into care. Reuse of sludge and its data was not available. What is happening to fecal sludge was not available. Indian context, in Indian context, fecal sludge and septic were interchangeably used. So these terms were not, the perfect meaning of the terms was not clear. So all these were some findings from the ground when we field tested SFDs, and we understood and gave a feedback to the SFD group, which helped us in improving the tool further. So that was one part where we applied SFD as a tool and brought some information from the ground. The other part is how we applied SFD in terms of advocacy. So for example, let's see the case of Delhi. When we made SFD, it was 56% safely managed, but we also made SFDs of some smaller areas in the city, some lower income settlements, some slum areas. For example, a JJ resettlement colony, popularly known as Savda and Ayanagar. All these areas are isolated areas in Delhi. So when we compare the SFD of Delhi to these areas, we can see the difference, and we can see how there has been an inequality in services. So let's further, we also measured, used SFD in measuring the progress. For example, let's see the case of Bijnor. When there was no sewer lines, no septic tanks, the city was 7%, was only able to manage 7% of the excreta and wastewater. When the sewer lines were introduced, we saw some change. And then further, when the co-treatment practice was done in the city, we can see a more change in the city. Further, a great achievement which we feel as CSE as a partner in SFD is that we were able to push this agenda into the manual of advisory on on-site and off-site sewage management practice, drafted by Center Public Health and Environmental Organization in 2020. So before we go to the further presentations in the webinar, I would like to ask all the participants to ponder on all these things. For example, we try to understand SFD would not tell you the technologies. It will also not tell you the cost that the town would incur in the initiative, but it will always enlighten you to prioritize where to prioritize. Just making SFD is not enough. It should be followed by plans and interventions for maximum utilization of hazard tool. How can it be clubbed with other tools like CSDA and energy assessment tool? And when you are making an SFD, what is your purpose? Do you want to understand a sanitation change in sanitation scenario, to understand the effectiveness of sanitation service delivery, or you want to determine the priorities? What it should be clear before you making an SFD. So from here, few things will be discussed in the further presentations. I will hand over to the presentations to Arne. Over to you, Arne.
Thank you, Harsh. Yeah, you're making it really easy for me as I'll say some similar things, and let's see how we can do this. Can you see my screen now?
Yes, clear.
Okay. Yeah, so welcome everybody. The story behind the SFD, why was it developed? Here you can see the MDG era. There we were looking just on sort of the start of the sanitation chain, the containment, the toilet, so to speak. And as the Sustainable Sanitation Alliance, we were defining what is actually sustainable sanitation. And we were saying it actually has to go along the whole sanitation chain. That in 2005, 6, 7 was not the understanding in the sector that much. And we were very successful as Susanna to really bring this into the discourse. And when the Sustainable Development Goals came up, actually they were following the definition of Susanna. And as you can see here, the Sustainable Development Goals look at the whole sanitation chain. And then in a meeting in 2013, 14, around that time, I came across the SFD, which brings together centralized systems and decentralized systems in that very logic. So it allows really to have the full picture. And so I was thinking this is really a great tool. And together with a group, we started to say, can we promote that? And can we really make it just not from an idea to a proper tool that can be used across the globe? And we said, yeah, let's do that. Sort of the inventors and the group said, we'll do it with whatever we can. And then sort of the foundation, the Gates Foundation, approached us and actually offered to be part of that journey. And one reason that as well Bill Gates himself likes that diagram. You see him here in a large gathering where he was sort of insisting that an SFD should be in his presentation. So quite some of the work then has been funded through grants of the foundation. Yeah, and then it started. Here are pictures showing that it started over time, and as well in India with the 60 cities publication that had been done earlier from CSE. That was a wonderful precondition to sort of actually look again at those data and then put them into an SFD. And as I said, this is the group of organizations that started, a number of universities, GIZ, Sustainable Sanitation Alliance, and the foundation. And prior to that, there was an analysis from the World Bank to look into excreta management in 12 cities. And that was sort of the first start into the SFD journey. Yeah, and so since then, we're going on. What were the tasks sort of to create a uniform, reliable way how to look at sanitation that can be done in a similar way across the globe, to bring this methodology in one place? That's the online portal, to manage that portal and to as well if people send in their SFDs as well, do a review so that we can say that those SFDs which are on the portal have all a similar and reviewed quality. And then promote this on a global level and encourage the growth of the SFD community. So as we saw there, usually you just see the diagram, and Harsh already said quite some things about how to read it, and I'll as well spend a minute on that later. But it's not only the diagram, it's as well the narrative report on service and outcomes, which has to be there, because we said, for example, there might be a large city which has been receiving either donor funds or in own net investment and has made a huge central treatment plant, but they did not have the capacity to run it or to replace broken parts. So it was not going. And the second one as well was sort of failing to function soon. So that should be in the narrative report, that first you have to have the capacity to run some such systems, or you have to have the enabling environment, so that you don't look at the diagram and say that, oh, let's just build something and then all problems are gone. So the narrative report has to look into the context, what is sort of the existing enabling environment, and then help you not to just sort of take too fast and too simple conclusions from the diagram. And then we're in an area where often there are no data, because if we look into informal settlements, if something is even not sort of planned or allowed to be there, how can you have data on it? So we said that, okay, where we don't have data, we'll have informed interviews and do estimates, but be very transparent on how we came to the data that we present. So a complete record of all data sources is number 3 element of an SFD. And with this, we could sort of go into areas where others never have been, because they said, oh, we don't have data, we don't have this, we don't have that. And we said, no, for the initial picture, we can get enough understanding of the situation, and we can put it into a picture that is easy to understand. Okay, so here we say SFDs are based on credible data, but not always on accurate data. It's starting with a containment. It's, as Harsh already said, it's the percentage of excreta. It's not a detailed planning tool. It's the going along the chain. It's the percentage of fecal sludge and wastewater delivered to treatment, and it's not a quantified tool. It's not looking into volumes, but into the percentage of excreta and where do they land up. And it's as well then looking into the percentage of treated or not treated excreta, and it's not a detailed assessment of treatment performance. So it's doing some of the things, and it's doing not all of the things, but it's a wonderful starting point. And as such, it helped as well bringing the topic into discussion, not only in Delhi, as Harsh pointed out, but as well in Kenya. It came into the newspaper. You were wonderful as well at CSA to put into the Down to Earth journal we had when then Bill Gates was meeting the Prime Minister. Actually, he spent half an hour on an SFD that was produced from the initiative and helped as well to enlarge as well in the Swachh Bharat campaign, sort of the focus not only to the containment, to the toilet, but looking into the full picture. And we had then this plus and plus plus, which as well brought in more sustainability into the whole campaign. Yeah, and now it's one of the better used reference tools in the sector. We have at the moment around 250 cities which are covered with about 180 million people, and it's presented not only by us but by different actors who find it good to explain their situation and what they want to do in presentations and so on. So it's contributing actually to the sector and to progress around that. Here in the lower corner, you see that it's starting with advocacy. Then if you're more precise and put in more time, you can go towards decision making. And if you put even more efforts, then you can go towards monitoring. An example is again the publication from CSE. So SFDs allow us for a more holistic understanding of urban sanitation, including all people, as well as including centralized and decentralized systems. This can contribute to more holistic urban water management and sanitation solutions. And with that, it can as well be used for an initial benchmarking, e.g. between cities, like they're planning to do in South Africa, or if in other countries, if you have a high number of SFDs, this process sort of will start on its own. And that's something else we've done on the website, that we've provided that dashboard where with a few clicks, these are data from, I think, last week where I looked into them. You can sort of have a comparison of all 53 SFDs from Bangladesh, for example, which at least already present 24 from roughly 160 million people. That's going towards 15% of the whole population and even more of the urban population. And again, here you can depict them as sort of a multi-city diagram and get an idea where are we standing, and as well do we have some progress. Similar, there are 76 cities from India which are in the database that you can say, well, it's just around 70 million people. It's 5% from the total population of India. Well, but it's of India, so it's a large population. And again, it gives you some hints as well on the broader picture. And like this, SFDs can be used to visualize and communicate as well progress. That can be done on a country level. And here we have an example as well from Zambia, similar like in Delhi, they've looked into the whole city, but they as well have looked into project areas. And what they've done, they said, okay, we are planning for an investment. What will be the outcome of the investment? And if we invest it like this, what will be the outcome? And if we invest it in another way, what will be the different outcome? And the SFD is a very convenient tool to show that in a very easy to understand way. So you can design scenarios and you can plan for your investment. And actually in the beginning, we said the effort to do an SFD typically should be done if there's a city where an investment is coming and where you want to make sure that that investment as well is reaching the unserved and not just improving the situation for those who already are in a slightly better situation. Recently, we had a publication from Kampala where sort of the greenhouse gas emissions and sanitation were brought together, and the SFD was used to visualize where actually greenhouse gas emissions are happening. Yes, they're happening in the treatment plant because you have to pump and bring in oxygen and so on, but mainly they're happening in septic tanks where the organic matter is transformed into greenhouse gases. And the solution would be more scheduled emptying of septic tanks so that you can bring the material to a treatment plant and then use the biogas or do something else with it. So that's an ongoing discussion, and we need more publications because that's just a very initial one. Some are financed again by the foundation, and I'm curious what we learn from them and how this will lead, where will this lead us. We as well had a similar point from Harsh already. I'm pointing at the sanitation journey where we have collected a range of tools and concepts. SFD is one of them. It gives you the baseline information. If you want to understand the key issues, why actually is the situation as it is, we have the city service delivery assessment, and all that can be the foundation to then create good city sanitation plans. WHO has sort of done sanitation safety planning that as well builds on an SFD, and like this you can have a more complete picture of sanitation. But I want to underline that in India we actually already have a very good urban sanitation strategy program and mechanism, and you have to think twice where to add additional efforts to visualize things or to have better information. And last not least, SFDs always put a focus on those remaining with unsafe managed sanitation, and thereby they help focusing on those people, and they help us to leave no one behind. And I think that's a key aim that we have when we work in the area of sanitation. Thank you very much. Back to you, Harsh.
Thank you, Arne. So, hello, yeah. Thank you, Arne, for detailed explanation of SFD journey in India and abroad. So, Hers, you can take it forward.
Yeah, so sorry, I got some internet issues. So thanks, Arne. Thanks for the wonderful presentation. And now I would like to call Alexander for the next presentation. Over to you, Alexander.
Yes, thank you, Harsh. Would it be
You want me
possible
to share?
to share? Yes, I'm not very conversant
It
with
is.
Zoom. It might take a while. Perfect. And in the meantime, yes, good morning or afternoon, everyone. And thank you, CSE, for the invitation. My name is Alexandra Dubois, and I work for GIZ as well as Susanna, the Sustainable Sanitation Alliance. And so today I will be presenting about the potential application of SFD. And for that, I will use concrete example that I have selected from the GIZ project portfolio. So my presentation is actually going to echo more or less the presentation of Harsh and Arne, in the sense that, yeah, I'm going to go a little bit deeper in the topic of usage of SFD. So I've compiled here in this slide a list of potential application for the SFD, and yes, among others, I mean, you've heard it, SFD can be used as an awareness raising tool. It can be used also for advocacy, coordinated dialogue, urban planning decision. We've seen the investment, informing investment, monitoring, and yes, last but not least, sector policies. So yeah, next slide. I will tell you when to go to the next slide. So this is the structure of my presentation. I see now this is, I'm missing one point, but yes. So I'll start with some background information on the relationship between GIZ and the SFD tool. I will then continue with the 4 examples from the GIZ project, which have recently used SFD. So there is one in Costa Rica, one in Benin, one in northern Iraq, and one in Zambia. Next. So yes, position of SFD within GIZ. As you might recall from the 2 previous presentations, GIZ is part of the SFD promotion initiative alongside with other key partners such as CSE. And yes, in that sense, it has been a long-term supporter and co-creator of the SFD tools, but also approaches. And that is even without mentioning that GIZ is currently hosting the Susanna Secretariat, which is managing the SFD portal and therefore is sort of in charge of supporting the quality control and the publishing process of SFD online. And yes, because of this historical relationship, it's of specific interest for GIZ to position SFD as one of the key sector tools and also to promote its use within its very large project portfolio. And yes, that's what I'm going to share with you today. Next slide, please. So we start with Costa Rica with the so-called Cotrisan project, which showcase a rather classical use of an SFD. So in that case, the SFD was introduced to the Ministry of Health, Water and Sewerage Authority and was implemented in 2 different pilot municipalities, Liberia and San Pablo, middle-sized towns, 67,000 and 30,000 inhabitants respectively. And so the overall objective of the project was, on the one hand, to scale up the use of the SFD in other municipalities, so to sort of use the pilot SFD as a showcase, and also at a more meta level inform the national sanitation strategy through the result of the SFD. Next slide. So at that time, the SFD generator was not yet available in different language, was not yet available in Spanish. And as you can see, the SFD diagram is still in English, but there was, and yeah, there still is a significant interest for the SFD in Latin America, and that was clearly demonstrated in the last Latino Sun conference, where a full side event was organized around the topic of SFD, and that really motivated us to carry out the whole translation work on the different tools, so the graphic generator, but also the report templates. And that was done not only in Spanish, but also French, Arabic, and Hindi, and it will soon be done in Bengali as well. So we hope that by having the SFD tools available in different languages, this will contribute to the further dissemination of the SFD worldwide. Next slide, please. So here we have another example of an SFD that has been conducted in a non-English environment. The bilateral program in Benin is called Agir O, and they have developed a joint SFD for 4 municipalities, which are forming the so-called Grand Cotonou agglomeration, which is the larger area of the capital city of Benin, and that counts more than 2 million inhabitants. So the objective for the project was, on the one side, to engage a dialogue on the sanitation situation in Cotonou with the various stakeholders, but also identify appropriate measures to and eventually use the SFD as a monitoring tool for the 4 municipalities. Next slide, please. One particularity of Cotonou, and it's a particularity actually of the whole country, is that the entire population, so 100% of the population, relies on on-site sanitation. So that's quite extreme, but that's actually the case for many countries in West Africa where there is absolutely no sewer line, not a single kilometer of sewerage. So therefore, an SFD assessment is of particular relevance in the sub-region. But the translation of the SFD tool and template report in French was a precondition for its dissemination. So here we are again, the need of translating the tools in various languages. And another realization which came from the SFD exercise, so the data collection, but also the analysis process, was that it was particularly difficult to identify the source of the fecal sludge that was arriving at the treatment plant, so the fecal sludge treatment plant. And that's the reason why the project decided to group the assessment of the 4 municipalities in one single SFD. So initially they wanted to have 4 SFDs, but then, yeah, it was too complicated to track the volumes or, well, the percentage of SFDs. And then from this realization, the project decided, actually in consultation with their partners, to work on developing a mobile application to be used by the truck operators and trace the origin of the fecal sludge. So that was sort of a side product of the SFD, one project that sort of occurred resulting from the SFD exercise. Next slide, please. So now we move on to the Middle East, to the MENA region, with the CONNEX project in northern Iraq. So the project implemented the so-called smart sanitation concept. And that was done in 2 refugee camps and in the one host community. And the whole concept consists of a holistic approach, holistic assessment of water and sanitation services. And for that, they're using a combined approach of using 3 diagnostic tools, the SFD, the CSDA, and the ACAM tool. So the SFD and CSDA have been already mentioned previously in the presentation of Arne and Harsh, and the ACAM tool, I'm going to come to it in a minute. Next slide, please. So yes, I said combined assessment through 3 different diagnostic tools. And those 3 diagnostic tools are considering 3 different aspects. So this SFD, as we know, it's all about safe management of excreta. Then CSDA, so the City Service Delivery Assessment, it's sort of the little brother of SFD, and it's considering the enabling environment for the provision of sanitation services. And finally, the ECAM tool, it's a tool that was developed by GIZ and that is evaluating the energy consumption and the greenhouse gas emission of water and sanitation services. Yes, so here in this slide, you can see below the SFD graph, we have the visual result of a CSDA with this scorecard format. So with green being the highest score and red the lowest. And so this combined analysis of SFD and CSDA and allows for a more qualitative assessment. So aspects such as regulation, policy, capacity, etc., can be added to the SFD assessment and therefore allow for a more accurate understanding of the sanitation situation and also enable a better search for appropriate solution. Next slide, please. Here we have the main results of the ECAM assessment. So that's how it looks like. Also a very powerful visual support which allow to project to identify the amount of energy being consumed as well as the greenhouse gas being emitted from three categories: water supply, wastewater management, and fecal sludge management. And here in the graph, you can see that fecal sludge management, it's the pink salmon part. And at the chart, the pie chart at the bottom, you can see that fecal sludge management is the main emitter of greenhouse gas emission. Next slide, please. So yes, the smart sanitation assessment was basically looking at all those three assessments and come up with conclusions, come up with both technical and institutional measures that would benefit both the environment and the involved communities. And so they suggested some measures, some long-term and short-term measures, which would aim not only to improve the rate of safely managed sanitation, but also reduce the energy consumption and the greenhouse gas emission from water and sanitation systems. So I'm not going into details in that. We can now look at the next case study, which is quite similar. So next slide, please. This is the case study of Zambia, where the bilateral water and sanitation program conducted the so-called carbon monitoring assessments. And they did this assessment in 6 different water utilities, 6 out of 11. There are 11 water utilities in the country. And similarly to Northern Iraq, they used a combination of SFD and ECAM assessment. And the main objective of this double assessment was to support the water utilities in defining adequate measures to improve their operational efficiency, but also reduce their greenhouse gas emission. Next slide, please. So yeah, here you have the one SFD, 1 out of 6. I selected Shingola as an example. Yeah, and 30% of wastewater and fecal sludge. Next slide, please. And yes, and here is the ECAM assessment, the result of the ECAM assessment, and you can see the volume of greenhouse gas emission in CO2 equivalent. So almost 22,000 tons of CO2 equivalent is being emitted per year for the whole utility of Shingola. So infrastructure, but also services. And then just for you to understand this table, we have in light blue above all the emission from water supply system, and in light red below the emission from sanitation systems. So then,
please.
Sorry,
just
I didn't get that. Should I conclude now?
No, I'm just saying a fasten up, please.
Okay. Yes, so what Zambia did, well, the further step that Zambia did in comparison with northern Iraq was to sort of bring the two results together in one single visual diagram. So a little bit to the model of Kampala that Arne presented earlier. Yes, they decided to bring the two results in one diagram. And the carbon emission are indicated according to their source of emission. So those are the black dots. And as you can see, the biggest dot, the main bulk of emission is located at the containment level of on-site sanitation system. And that is being followed by the wastewater not being delivered to treatment. So yes, this superposition of the SFD and the ECAM assessment is quite new, it's quite innovative, and it's we can predict that it's going to be a very powerful advocacy tool, as it really highlights the fact that in the context such as Zambia, rather than focusing our effort and investment on optimizing wastewater treatment plant, wastewater treatment systems, which is what tends to be done when it comes to urban sanitation planning, climate change mitigation measures need to address the problem of long and inadequate retention of fecal sludge in the pit latrines, but also septic tanks, and also unsafe disposal of wastewater. So even to a non-sanitation expert, it's very easy, it's very clear that the focus must be on on-site sanitation and fecal sludge management rather than sewage and convention treatment plants. So yeah, that's sort of this new thing. And yes, we probably have enough example for today, but I just mentioned two projects, and actually the second project was already mentioned by Arne, so I'm going to go very quickly on this one. So first is the RUAS project in Uganda, which was one of the first projects in GIZ, but also outside GIZ that implemented SFD. And the assessment was conducted in Kampala and 6 other towns as part of town planning process. And the second example is the CFS Lusaka project, and that's the one that Arne described, with the 3 scenarios, the 3 projected SFDs that help to inform a very large joint investment by several development banks. There was KfW, World Bank. So it was quite a major project that was informed through SFDs. So that was also quite unique. And yeah, that's it from my side. Thank you very much for your attention, and sorry if I went a little bit over time.
Thank you so much, Alexandra. So I'll call the next speaker, Mr. Vikas Kumar Agarwal. He is a director of RSTPL in Guwahati, and he is also one of our very productive alumni and one of the very initial persons who delved very deeper into SFDs and worked very seriously on SFD. Let's see how he has worked on SFDs. Vikas, would you like to share your screen? Or do you want me to share?
Yeah, I'll share, Hershey. Thank you.
Please share it.
Is my screen visible, Hershey? Good afternoon, everyone.
Visible, yeah.
My name is Vikas Agarwal. Thank you, Hershey, for the introduction. I have a small business here in Guwahati, which is focused on wastewater treatment and solutions. I developed an SFD light report for Tinsukia in October 2020 as part of an initiative launched by CSC in developing change agents for writing SFD reports across cities in India. So my presentation would focus on what are the challenges in doing the SFD report and what are the field observations. Now, when I visited the ULB for doing the study, I found that majority of the population was not aware of where does the shit go. It was just a flush and forget concept, which has been highlighted in various studies and research. In areas like a majority of the ULBs in Assam, they are dependent on on-site sanitation boxes. and which are not designed technically, either in absence because of the absence of bylaws, or the machines who were doing it were not aware or trained on the designing aspect. And emptying of these boxes were done only when there was a need, and because of the absence of bylaws. Also, it was observed that in floods, most of these tanks, the on-site sanitation boxes, they used to get submerged in flood water. And this was an area of concern which got highlighted during this study. Also, in hilly areas, these mechanized vehicles were not apt for emptying the boxes, the on-site sanitation boxes. So this was something which we could learn in the field observation. But the challenge was, how do we quantify it? Because getting an understanding through field observation is easy, but getting the data was always a challenge in India, because we do not have the good amount of sanitation data available. So, if we look on to doing, when we do the SFD study, so we get data from two sources. One is the field-based research, and second is the desktop-based research. Now, for the desktop-based research, you can get data from the various published reports, like the census report, or maybe the ULB city profiles, which are unpublished, or maybe the DPRs. But there is always a need to triangulate the data that is available while doing the report. And as Arne had mentioned, and Hershey has also mentioned in the presentation, in the respective presentation, that the transparency of data is very important. What we lack is, it is true that you'll not get the exact data or an accurate data, but you need to be sure about the transparency of data. And plus, whatever assumptions that you make in the report is logical and is the available data driven. And plus, like what Arne had also mentioned, like maintaining a record of whatever data that has been captured from the field study is of paramount importance, so that it can be of future reference when this SFD is developed further or is looked into for sanitation planning. Another aspect of the preparation of SFD report is knowing the key terms that are used in writing the narrative report, as well as doing the graphical presentation representation. Now, although we being sanitation from the field of sanitation, but understanding these terms are of most importance. Like for instance, like she had mentioned, like in India we use fecal sludge and septic interchangeably, but in some other part of the geography, like some other part of the globe, it may not be used interchangeably. So understanding these terms are important. And plus, like in India, CSE has developed this the SFD graph, which is called adapted SFD, which focuses on the supernatant. Because here, like because of the building bylaws, absence of building bylaws, the tanks are not emptied regularly. So what flows out the supernatant in Indian context is more lethal to the environment. Plus, there is a need to establish a connect with the various stakeholders, whether they are the households or the sanitation workers, or maybe the municipal administration, or the marginalized section of the societies who stay in the slums. So, now coming to the next slide, where speaking on the data. So as it has been mentioned previously, that the source of data is of most importance, and we need to be doubly sure of like how we are capturing that data in our narrative report, as well as in doing the graphical representation. Say for instance, like if you look onto the groundwater contamination, so that is something wherein you need to have a good understanding how groundwater may impact the the discharge that is happening in the ground because of unsafe sanitation practice. Now, next key question for SFD makers would be where to start. So if you look onto the sanitation value chain, so a good starting point would be to start with the desludgers or the emptiers or the sanitation workers, because that would help you get a comprehensive understanding of the various sanitation value chain, starting from the containment to the emptying. And in this, you also get a chance to understand how the different wards in the ULB are covered and how do they practice the sanitation, how sanitation is practiced there. And how do you start is capture all data that you get in the various forms or the sheets that you maintain during your work. And when you go into the field, you see the various aspects of how things look into real life. Like for instance, the size of the septic tank, or for per se, on paper, we would be seeing that we are ODF free, and is it like really being practiced in the slums or the unauthorized slums? This was what came out for Tinsukia, where we could see that 97% of the sanitation was unsafe, the discharge was unsafe, and that was primarily because of the absence of offsite, because most of the population was dependent on on-site sanitation technique, and plus there were gaps in the sanitation infrastructure.
Vikasi, 3
And
minutes.
yeah, just 2 more slides. And the impact that we could see happening from the SFD study, the publication of this report coincided with the Assam government introducing cesspool vehicles in various ULBs. And also, we had published a blog on Down to Earth to create awareness amongst the masses on what is the sanitation scenario in Assam. And also a local web channel there in Assam, in Tinsukia, by the name of Assam First, had published a 4-series program in the name of Swachhta Ki Aur Ek Kadam to generate awareness amongst the masses on the basis of the finding of the SFD study. Going forward, we are doing SFD for Guwahati, Gwalpara, and few other cities in Assam that will be taken up in 2023. And one reason is Assam government has floated tenders for setting up of FSTPs. So we want that good amount of baseline data is developed with the help of CSC. And also, we have support from UNICEF for this project. So this is it. Thank you so much. And I hope this presentation is useful to people who intend to start doing SFD, giving them a basic understanding of how to go about it. Thank you so much.
Thank you so much, Vikarji. So I would like to call upon our next speaker, Paresh, who is also moderator of Susana India chapter. Hi, Paresh. Are you able to hear me? Paresh, we are not able to hear you.
Am I audible now?
Yes, yes, you are audible.
Okay.
Do you want me
Sorry.
to share?
Yes, please. Okay, till the time Harsh shares the screen, what I'm going to be talking about is in detail about what Arne did show, the SFD of India using that we had on the repository, and also an example of how we and I will on that I will also discuss the potential and opportunities, potential for use of SFD, the opportunities we as professionals and research while using the tool.
Paresh,
So
your
next
voice is
slide, please.
breaking. Hello.
Paresh, your voice is breaking. Can you check your mic, please?
Okay, my voice is breaking, so let me try and talk from the phone instead of the computer. Is this better?
It is better.
Yeah. Loud and clear.
Just a moment. Okay, so I will not be able to hear you now, but I will keep talking and let me know if there is something. Harsh, you can show me a hand gesture and I'll be able to look at. Okay, thank you. So let's go to the next slide, please. What I'll be talking about is use of SFDs in India, who have been using them and for what purpose. I'll be discussing the findings from a cumulative SFD in India, example of Alapura or Alapi, other opportunities that to some extent have been discussed earlier by Harsh and Anna and Alexandra. And then I will conclude my presentation. Next, please. So SFDs in India, we've had about 80 SFD reports on the Indian from India. You can see the map, which is again available on the SFD portal. And as somebody pointed out in the or asking in the chat, can they be prepared for small towns? Yes, of course, they have been prepared for small towns. In fact, CSE has done a terrific job of doing it for sub-city level settlements also. And they have also been done for large cities. So we see that in India, there are 14 million plus cities for which SFDs are available, as well as for 58 small cities. By small cities, I mean cities of less than 1 million population. And there have also been revised versions. So say for Bijnor or Chunar, where you have a SFD, which was before a treatment facility was started and after that. And you can very well, as Arsh pointed out, see the difference in the situation in the town. But also at the same time, let's be aware that this is not the complete picture of use of SFD in India. We have a couple of more variations that are in use in India. One is by CEPT University and the other by ASCII. And I'm sure you may have access to CSE's. CSE did a webinar on the different variations, and that should be of your interest if you're looking to get to more about these variations. At the same time, the spread is not uniform. So we have lot of SFDs from UP thanks to CSE, and a lot of them are also across India also thanks to CSE, but we have very few from Northeast states and almost nothing from Gujarat and Chhattisgarh and Jharkhand. So if you are from these states, this is an opportunity to contribute to understanding the sanitation situation in terms of SFD. Next, please. We can see this is a cumulative SFD of India. And of course, because we have a lot of large cities from where this data is getting captured, you'll see that a lot of households or a lot of a higher share of the population is connected to offsite sanitation or fewer systems. And a fairly large or more than 50% of the wastewater and fecal sludge is getting managed. Next, please. But there is importantly, there is open defecation still practiced in cities. And many of these reports have been prepared after 2019 when the country was declared open defecation free. So we need to point that out to policymakers so that these decisions or these findings lead to a better access to sanitation. Next, please. Again, as a lot of on-site systems are septic tanks and they produce supernatant. However, in the SFD, I don't think that is adequately captured. Importantly, its management needs urgent attention, and from a person who's engaging in getting into or preparing a shit flow diagram, that I think is an important opportunity, that we also need to be aware that management of supernatant is kind of hidden in the shit flow diagram, but you need to be, as a professional, you need to also point that out to policymakers. Cities report use of on-site systems that are not very safe. So pits in very high groundwater table areas, which kind of allow passage of water in and out, passage of water, are unsafe. Emptying cycle, the Indian norm is emptying once every 2 or 3 years. However, even in the reports that we have on the portal, city, we've assumed as much as 10 years, assuming it to be safe. So that's another area that of concern. In cities, both private and public sector is involved in service provision, and of course the quality and the charges vary. Importantly, manual emptying has been reported in many reports, many reports. Unfortunately, it cannot be quantified in terms of the dependence on manual emptying, because as you may know that it is illegal. But there is cities are aware that manual emptying is practiced, and it needs to be taken care of. Where treated, reuse of FS is not, fecal sludge is not reported, and unsafe use of fecal sludge is also reported. So next, please. Sources of information, as Vikas rightly pointed out, data is a big challenge. And we have census which gives information for OSS, but that may be inaccurate, and you may need to do ground truthing, especially if you are dealing with SFDs of higher levels. If you want to do a comprehensive SFD, you would want to ensure that the information that you are putting into the preparation of the graphic is of good quality. Information related to management of supernatant is generally not available, and therefore this points to a need of household surveys, and another point that I'll be making later. Where private services are involved, emptying related information is not foolproof, and therefore you need to be able to triangulate, or you should aim to triangulate information from different sources. Again, as I pointed out earlier, information related on-site manual emptying is not related. Treatment related information where treatment facilities are available is generally available. And again, quantity of reuse is generally not available. Next, please. An earlier review by proponents and user and developers and proponents of the SFD tool identified 5 failures that typically occur in the FSM service chain or wastewater service chain. And we see that all these 5 failures are prevalent in India. Wastewater from offsite system or sewers not delivered to treatment, wastewater delivered to treatment but not treated, fecal sludge not contained at all and not emptied, fecal sludge and supernatant emptied but not delivered to treatment, and then delivered but not treated. However, there is an important failure in the Indian context which is not right now captured, and which is captured in the diagram but not adequately highlighted, is the wastewater not contained. And if you see the purple arrow on the diagram, that's where I'm hinting at. And cumulatively in India, about 2% population relies on toilets that dispose wastewater directly into stormwater drains or open grounds, etc. But in some cities, it is as high as Bikaner, it is as high as 23%, and that is a point of concern. So therefore, one needs to be aware of challenges or limitations of the SFD tool itself. Couple of other points related to SFD, but I'm not going to emphasize that right now. Let's go ahead. In example of Alapura, next please. So we did find out that, okay, again, most of the fecal sludge is not treated, and what is shown as green is essentially safe containment largely. So lack of treatment facility, as one can see, there is no treatment facility, and therefore that is the biggest bottleneck or the biggest challenge in the FSM service chain. But to get into details, next please. There are also other limitations as the analysis from the SFD points out, that many of the on-site systems are not appropriate for the town, and therefore their replacement in the long term is necessary for groundwater to not get polluted, for public health safety, so on and so forth. As I pointed out, manual emptying is reported. At the same time, the mechanical emptying services that are available, they are not regulated. So we are not, as a planner or as a city government, we don't know what is happening with fecal sludge once it is emptied. There is no treatment facility, agreed, but there are 3 plants in the vicinity, so there is an opportunity to co-treat fecal sludge in other plants in the vicinity till the time you have your own facility. And we've not assessed reuse possibilities right now, but that is something that we'll want to do in the future. Next, please. And couple of other opportunities which have been highlighted. So Harsh said that we should be aware of the inequities between cities and certain parts of the city, slum settlements or certain wards that are inhabited by low income population. But at the same time, we should be aware of the differences in or availability of services in big cities and small cities. If you see between the two diagrams, so in big cities, there is a lot of higher dependence on sewer systems, and a lot of these wastewater is getting treated. Comparatively, in small cities, again, this is skewed because there is a city called Panchgani where almost 100% of the wastewater is collected and treated. I mean, point is that if you have numerous SFDs coming from a state, there is an opportunity to compare what are the service levels between cities. Next, please. And Harsh has spoken about the next slide, so I'm not going to get into that, but it helps the SFD of settlement. So whether you choose to do a SFD of a city or a settlement within a city, you are contributing to the discussion within the city. And as I may argue, even at the national level or even at the state level. Next, and my concluding slide, please. So there is a potential of using the tool for regional and global monitoring. By regional, I mean at the state level and at the national level. There is potential to highlight inequities between cities and within cities. A lot of speakers spoke about lack of data, and that presents an opportunity to innovate. And from here, I will briefly talk about for a moment about an example of Alapura, where we use youth, that is university students, who almost everybody has a smartphone now. And we have open source mobile applications like ODK Connect and Kobo Toolbox. And these can be used for household surveys. So this combination can be a very powerful and a very economical tool of collecting data for not only for SFD, but for the city to have some understanding of anything. Okay. So now that we've seen the SFD of India and how what are the bottlenecks, there is an opportunity to plug into policies. And because the tool is so well developed now, the new education policy talks about, and this is not for students, but for us as panelists, new education policy, which talks about multidisciplinary education and experiential learning, as well as Unnat Bharat Abhiyan, which talks about collaboration between local institutions and local governments. There is an opportunity for us as professionals to contribute to use these policies and formulate partnerships. And as researchers, as individuals who are engaged in use of SFD, there is an opportunity to refine the tool itself. I agree that the tool is a very well placed or very good tool right now, but I'm sure we can find opportunities to refine the tool itself. Thank you.
Thank you so much, Paresh, for such a wonderful presentation. It was very fast and very informative to the point. So let's move up to our next speaker, Mr. Sarim Ansari, who has been working in CSC as a program officer, and he has been involved in CSC SFD initiative and making SFDs from 2018. So Sarim, would you like to share a screen?
Yes, am I audible?
Yes, you are audible. Do you want me to share my
Okay.
screen?
No, I'll share mine.
Please,
Just
please.
hold a bit.
Before Sarin starts, I just brief you about like how he's going to take you to the how SMDs have been utilized in programs and advocacy in Uttar Pradesh state of India, and what we have achieved from there. Sarin is going to cover all this. Thank you.
Harsh, is my screen visible?
Yes, here, please.
Okay. So yeah. So myself, Sarim. Just a brief background what Harsh already said. Myself, Sarim. I have been working with CSE for the past 4.5 years, and majority of my time in CSE was with working with SFDs. So I have a bit of idea. I won't say I know everything, but I know how to do SFDs. So I'll be sharing the journey of SFDs in UP, how it started, and where are we now, and the learnings of what we got from SFDs in UP. So yeah, I'll start. So essentially, SFDs in UP, the journey that began in 2016. Uh, after the after CSE partnered with this group of institutions that were working on SFDs, CSE did a study, which Harsh pointed out in his presentation earlier, of developing SFDs of 10, 11 cities in India. So out of those 10 towns in pan India, 4 were from UP. So once the SFDs of those 4 cities were made, CSE did advocacy around uh, uh, city sanitation plans, developing city sanitation plans for these cities, did some studies did some capacity building programs in UP around those 4 cities, developing city sanitation plans for those specific cities. However, the reach in UP at that time was limited. CSE's reach was limited. So that was a brief background how the SFD work in UP started. The selected cities in UP at that time were Gangaghat, Ramnagar, Bijnor, and one more, I'm missing its name, Chunar. Yeah. So that was the basis of SFD, CSE's SFD work in UP. Uh, as I already pointed out, the reach of CSE's work at that time was limited. So what was the trigger to expand CSE's reach, advocacy, the work CSE does? Uh, it is to be noted how we did it. So that work was done in 2016. I would say a catalyst to increase the footprint of CSE in UP was this MOU, which we did with the Department of Urban Development in the year 2018. So essentially, this was revolving around fecal sludge and septage management. And I would tell you about it more in the coming slides. Essentially, the FSSM work in UP, what CSE did, advocated, was largely intertwined with that of SFD work. So yes, moving on, I'll just give you a brief of what CSE did. The timeline is essentially an intertwining between SFD work, the FSSM initiatives, which we did, and the related activities and outcomes. So in Jan 2018, we signed an MOU with the Department of Urban Development. Uh, in Feb, we came up with the guidelines for fecal sludges and septage management. We did few trainings. Then we did a big event in UP where we launched part one of 66 cities SFDs, which we made. Uh, and after that, we did few more FSSM related trainings. In Feb 19, we did uh, this NMCG approved our DPRs or assessment report based on which they funded our Chunar and Bijnor projects. Next year, moving to 2019 in April, the second part of our assessment report was launched. So it was for 66 cities. I'll brief about the cities report, the outcomes about it at a later stage, just going through the timeline at the moment. So then again, we did some SFD trainings, we did some trainings around FSSM. It was like we did FSSM, we did SFD, we did both. We in August 2019, we came up with the co-treatment report, which was essentially done on this STP in Lucknow. A part of that report had a situational analysis of Lucknow, and it was depicted through SFDs. The Lucknow SFD, which we presented in our earlier event. In October 2019, the FSSM policy came out. And December 19, based on our advocacy, our push, the state issued tenders of FSTPs and co-treatment. And in 2020, there were the study for 21 towns using SFDs were done for NMCG. And coming to the next point, in 2021, we did some small studies. This was only for few cities where we mapped inequities. As Paresh already pointed out, we did mapping of inequities within a city for few cities. So this is a brief background of or brief timeline of what we did using SFDs in UP. So coming to the point, coming to the state workshop, which we had in April in 2018, October 2018. So this was the first major event that in which we used SFD findings from this cities which we visited. 66 cities we chose, and out of that 31 report of 31 towns we published during this event. So this highlighted the ground scenario of sanitation, the gaps in sanitation of these cities. It was very well received. And along with this, we also launched Sanikit and Mount platform. Basically, a Sanikit was a tool, online tool for preparing city sanitation plan, advocacy of which we did earlier, as I mentioned earlier. And Mount was an aggregator tool which had details of all the technologies, FSTP technologies or DWATS technologies. The baseline data of a few of these towns was included in this Mount tool. So this was the first event where SFD was used as an advocacy tool and also used as a baseline tool for getting some data. So now just to highlight what major things came out of this event, the study which we did, it showed that no town in UP was 100% sewered. More than 60% of the total population was dependent on on-site solution. So this was the major thing which came out of it, and it what it did was it woke the officials up. It made them realize that yes, this is also a thing or off-site sanitation along with on-site sanitation is also an issue, and they need to address it in some way or the another.
Sorry,
So-
2 minutes from now.
Okay, so moving to next event. This was an international event. This was named as SFD Week, and the highlight of it was the work done in UP. The part second of 66 cities report was presented in this. DG, NMCG, and Secretary Moa launched it. So basically, this gave a platform for UP. The UP scenario, sanitation scenario was highlighted in this event, and this prompted state officials to take up FSSM initiatives, or at least talk about FSSM initiatives in UP. So this was followed up. All these events were followed up with another report, which we did on co-treatment in Bharwara, which I already mentioned. So this all prompted the state officials to actively take up some measures to tackle sanitation scenarios or sanitation gaps, or largely FSSM, how to do FSSM. So this prompted the state to go for SSM plans, FSTPs and co-treatment in 2019. So coming to the next point, the tool, the SFD tool was also used as a planning and monitoring tool. And this was also done for two cities which we took up, Chunar and Bijnor. Based on request from NMCG, we did DPRs of those two cities, assessment report of those two cities, where SFD was an important part of the report, which highlighted this sanitation scenario of the city. And based on those two reports, the funding of these two towns to take up FSSM initiatives were approved. So this was a part of, right now, what is being shown in the slide was a part of that report for Bijnor town. Apart from that, SFD was also used as a monitoring tool in UP. On your right, you can see two SFDs, the comparative SFDs of before and after. One you can see is of 2017 and another is of 22. The change in sanitation scenario, this we tried to monitor using SFDs. And this change of sanitation scenario was actively communicated to the city sanitation committees, CS change over years. So this was also a tool for monitoring. As I already mentioned, that it was also used to map inequities within cities. You can see here that in Bijnor, the whole city's SFD is of 75%. The safely managed excreta is 75%, but a low income settlement area, that is of Ravidas Nagar, the safely managed excreta is only 35%. So the gap, the change in the SFD highlights the gap that within a city
Sorry,
there. Yes.
we are running.
Okay. Okay. So this you can see that there are gaps within a city. So what learnings from our journey or conclusions from our journey was that essentially our FSSM work in UP was through advocacy of SFDs in the initial part. This was also used for enlightening city officials about the sanitation status of the town during meetings. This was used as a monitoring tool to assess the sanitation situation before and after. This was used for developing city sanitation plans of towns. And this was also used as a baseline for pre-assessment feasibility studies of a town in a town. and also a baseline study for mount like tools, online tools that CSE developed. So that is it from my side. Yeah, thank you.
Thank you so much, Sarim. A very wonderful presentation to the point. So now we have almost done with the presentations. We'll like to take few questions, and also like when I started with when in the contest setting, I pointed out few things like how we can, what we can ponder while listening to the webinar. That can SFDs be? What are the applications that can be understood? Where SFDs can be applied? How versatile? How in a broader way SFDs can be utilized for betterment of the city in terms of sanitation, in terms of excreta management and all. So I hope we were able to cover most of that in the following presentations after that. So there are a few questions which I have marked. So one question is for Ane. So Ane, you there?
Yes, I'm there.
Hi, Ane. So Devika wants to ask you that does SFD also takes into consideration about the sullage and sewage during its course? Just it's a very basic question, but yeah.
Yes. So I'm not really. I don't know if I get the question. Maybe I can say like
So
this.
let me reiterate. Do SFDs also account for sewage and sullage waste managed by nature-based solutions, or does it only look into grey infrastructure?
It looks on all elements of along the sanitation chain. So if these are if the treatment is done via plant filter or so, then that's well taken into account. However, it's not looking into quantities, but it's looking on to percentage of excreta. Where are they going? Does that answer the question?
Yeah. So one question for Alexandra from Mohammed Shakawat. How did you measure GHG emissions and incorporate in SFD with support of secondary data or other method?
Yes, I mean it's a completely different process. So it's not, the assessment of climate greenhouse gas emission is not part of the SFD assessment. It's a complete different tool, which really measure quantity, and it's based on accurate data. And then, yes, that is why it's still very new and it's still very innovative, because the combination of both results requires a little bit of process. Huh? We are comparing pears and apple, and basically we're trying to put all those information, percentage of population with CO2, with kilogram of CO2 equivalent in one diagram. Yes, and the idea in the future would be to have some kind of a feature in the SFD that could calculate that and kind of integrate this assessment within the overall SFD assessment. But at the moment, it's not yet the case. I hope I answered the question.
Thank you, Alexandra. So one more question from Neha G. I don't know who she has targeted, but let me just put on the question. So how she wants to understand and how this program of sanitation can be put into the food industry. Or if I reiterate the question, are there any plans in the future? Can SFDs be linked to the food industry? Anybody would like to answer?
At the moment, they're looking into excreta. They're not looking into food industry. So I'm wondering how the SFDs have inspired lots of other Sankey diagram approaches. So the door is open to look into organic matter and organic waste. There's actually a organic waste flow diagram, I think, that's somebody tried to develop. So that would be another source. However, I would like to point out that as if you know the number of people in a city, not as such as well, there are discussions around that as well. But if you estimate a number of 1 million people, then you know how many excreta you're talking about. And that's sort of a very easy starting point. If you take the food industry, you have to calculate how many materials are coming in, how many are going out. So that's a more complex thing. So the SFD has quite a simple starting point, if I may say so.
Next, I would also like to ask participants if they have any questions. They can also raise their hands. I can see if we can call it out. Meanwhile, another question from Arka.
Mr. Shakib raised hand.
What is the So just this question. Is there any set protocol for frequency of SFD exercise for cities implementing urban sanitation? I would like to answer. No. I guess there is no set protocol. It all depends what intervention you want to plan, how you want to plan the sanitation improvement in the city, and then you can employ SFDs in between and see what's the direction you want to give. Is it going in the right direction or not? That's all up to you. Thank you.
Mr. Sakib raised hand.
Mr. Sakib has a question. Sakib, please.
Sir, good afternoon, sir. Sir, ये बताइए, can you speak in Hindi? Can I speak?
आप हिंदी
सर
में
मैं ये
बता
पूछ
दीजिए, I'll read it in English.
यस सर, मैं ये पूछ रहा था, जैसे वर्मी कंपोस्ट बनाते हैं को ट्रीटमेंट में, इसका जो है एसएफडी पर इसका क्या फर्क पड़ेगा? जैसे कंपोस्ट बना दिया हमने, वर्मी कंपोस्ट बना लिया, उसको मार्केट में बेच दिया, तो ये इससे एसएफडी पर क्या फर्क पड़ेगा?
So Ane and all the panelists, I just want to reiterate the question Shakib has asked. So what he's saying that if we are making a vermicompost after the product of co-treatment, then can this vermicompost affect SFD or not?
Can I answer that?
Yeah, please.
Yes. Yeah, so you can treat the fecal sludge, or you can consider the fecal sludge as treated. And right now, the SFD does not capture in the graphic reuse, but in your narrative report, that should be very clearly mentioned. And if possible, if you have the quantities, those quantities should also be mentioned.
So Shakib, I hope आपको Shakib शायद आपको आंसर समझ आया होगा.
जी सर, समझ गया.
ठीक है, thank you. Any other questions, please?
Do we have any other questions?
Yeah, please.
I just read this question about the fragmentation of institutional mandates. Who is taking responsibility of producing the SFD when we have different mandates between on-site sanitation and sewage sanitation? I found this question quite interesting. I can't really respond for all cases. I would say for the 4 case study that I presented, which are mainly in sub-Saharan Africa, I would say that there are different scenarios. There are actually two scenarios that are that I identified. It's one when the water utility is taking on the responsibility of the full sanitation chain, including on-site sanitation and fecal sludge management. That is more and more the case in East Africa, where water utilities do not want to have a fragmentation in sanitation responsibilities. And in that case, the SFD is being steered or led by the water utility. But then when you go either more in the Central Africa context or West African context or rural areas, then it is usually the case that municipalities are the one steering the whole process. So it really depends on the context and who feels more responsible of that task of mapping the whole sanitation service situation in one specific area. I don't know if someone wants to respond for India or for the South Asia context. That would be very interesting.
I'll be happy to add for India. May I?
Yeah, Paresh, please.
Yeah, so for in the Indian context, it's generally the local governments or municipalities that are responsible for sanitation service provision, but they may not always own up the mandate, and therefore where the ownership of mandate is already there the local governments will typically hire consultants to prepare or to understand the sanitation situation. But often in most of the cases, as I've seen, this has been donor driven. So CSE had, or even I did SFD out of my own research interest, but I have not seen many SFDs that have come out of individuals' interest. They have typically come from donor interest. So, or at the state level, if there is interest, then they have requested organizations to do SFDs of multiple cities in the state, and then the organizations have approached the cities, and because there is an order from the state, then the cities have typically would not disagree. That is the case. But I have also not come across a city, and CSE can, or Harsh and Sareem can correct me if I'm wrong, where the local government has taken in India has taken initiative and approached somebody to be or prepare a ship flow diagram report. So that's right. Currently the case is my understanding, but typically in India, it is local governments who have to take the initiative. And I agree that there are multiple stakeholders often at work, and their interests and their interest can vary. But at least the planning process of which SFD is a part can bring all these stakeholders together. So as consultants or as researchers, our job, one of the parts of doing the SFD is also to get all of them together, say for a consulting workshop or for discussing the ship flow diagram, outcome of the ship flow diagram report itself. So that is one of the tasks when we as work with local governments. That is one of the tasks we have at our hand. Thank you.
So adding to what Paresh was asking, like, so there was an instance in 2021 when one of the city in Uttar Pradesh asked us to make an SFD, but their inspiration behind that was that that SFD will give them the technology, or will name it the technology. So that's why in my context setting presentation, I already pointed out that SFD would not tell you the technology, but it can help you to prioritize where to set the technology or where to intervene in the sanitation scenario of the city. So that was the one instance when the local municipality asked us to make the SFD for them. But then we kind of explained them that it's not the purpose. You have understood the purpose in a wrong way. So that's the thing. A question from Rashi. I hope if anybody would like to answer, or I'll answer. How this integrates decentralized facilities when preparing SFD for a city, specifically private facilities of treatment? Do anybody wants to answer? I proceed. So Rashi, so when we are talking about the decentralized facility and when we are making SFD, we kind of clearly define that what population we are capturing. So if that population using the decentralized facilities is under the population that we are targeting for the SFD, then we take it as a 1 and see how much wastewater is coming from their areas, and see how much is not reaching to the treatment, or if the treatment is happening in the ideal way or not. So this is how we integrate in this. Any other question? Anybody wants to raise hand?
Just to add to Harsh's point, it is also captured in the, not only in data, but also in the narrative report that, okay, this is the, and this is often, as you may find in the case of Bangalore, there are some 3,000 decentralized treatment units operational. So you will know, or so the city authorities will know that, okay, this is roughly the population that is depending on decentralized solutions. And what is the quality? I mean, what is its load on cities infrastructure vis-a-vis what is the quality of treatment that is happening within their premises? So that kind of an array, that they will have a fair idea. They may not have an accurate idea about it, but they will have a fair idea about it.
And the narrative about it would be given in specifically in the report as per issue. So I guess we are done with the question. Jyoti, are you able to see any other questions?
There is one question from Dr. Zakir Hussain, so I'm allowing him. Yes, Dr.
Yes, Zakir ji, please.
You can unmute and ask the question.
Dr. Zakir, you can unmute and ask the question.
I think he's not there, so you can conclude the webinar and.
Yes. Now it's audible.
Yes, please, Dr. Zakir. Yes, I am able to hear you.
I am from Assam, India, Guwahati city. So our problem here is there in city sanitation. So we have so many sediment, that means erosion from this loose soil of the hills, which block the drainage system. So is there any technique how to solve this? Every year we have to clean the drain and then the water flows down. That is the problem we are facing. Actually, I am not in a position of the authority. I am a veterinary doctor and associate professor of College of Veterinary Science. This problem I see. Actually, I am not directly concerned about that or dealing with that, but it is my experience.
Thank you so much, Zakir.
Yeah.
Dr. Zakir, here we are discussing about the sanitation systems and how to, how shed flow diagram is one tool. So what you are speaking is more like a landslide or a wash away from the mountains or the hills, which is choking the system.
Draining system, particularly drainage system, I am asking about actually.
So we will not be able to, discuss or answer this question because we are dealing with the
Yes.
and the septic tanks at the moment. But it's a question.
And one more thing I want to ask, as I am a veterinarian and from dairy farm, the waste management is best method. I think it will be either biogas production or this vermicompost like that. But the problem is that biogas production during the winter season, it is very less. And how to overcome this problem? The production of gas is very less during winter season in a biogas plant. Is it possible to answer anybody?
You get in touch with us separately, Dr. Zakir. We will discuss that. You have our contact. Okay. We can discuss that separately.
Thank you. Thank you.
So, Jyoti, anything?
Yeah, so now I request sir for the concluding remarks.
Thank you for, I don't have any concluding remarks. All I wanted to say was that we've been doing SFDs for a very long time. And the time is right to actually think and work together with a few people who are interested in pursuing this issue further on how we can, make use of the lessons learned in implementation of SFDs. So I think it's a good time to form a small group. In this webinar, of course, it's multi-country, it's not just India. So I think in each context, if a few people can get together and take this conversation forward about lessons of implementation, they are actually very important to discuss what happens on the ground and how we can improve this tool and its use. So I just wanted to highlight that, and I wanted to, of course, thank all the panelists for their time and sharing their excellent work which they have done, and also all the participants and Jyoti was telling me there are about 10 registered from Ethiopia also in this webinar, and they would be others as well. So I would just like to thank everyone for being here.
So just wanted to add, today we have started one online training on SFD. So we have received around 70 plus registrations. And if anyone is interested, we are still open, so you can contact the coordinator and get registered.
On the CSE website.
Yeah. So go through the CSE website. There is an announcement of SFD training. We will conduct a residential training as well, and we'll float the announcement and let you know. So thank you, Hers. You can.
Jyoti, yeah, I just want to add some few last points. So as the name of the webinar, it's said about something about potential and opportunity for achieving sustainable citywide sanitation. And we have come across different presentations and different understandings on like how SFDs can be implemented with clubbing of other assessment tools. So that's the way where we can see that how holistically we can come up with studies to understand a city and plan for the city in terms of sanitation, in terms of other soft aspects in sanitation. Plus, as we can see from the examples of shared by Vikasji and Sarim, that how things can be planned before delving deeper into the SFDs and see what that plan can execute and how we can measure it by the time. So this is what we wanted to understand from this webinar and see how the SFD is just not itself just one thing, a graphic report, but it can also help in other ways where we can plan, we can execute sanitation initiatives, programs, and meanwhile we can also monitor, we can also measure, we can also do advocacy and invite more funds and more what we call as participation from the citizens by showcasing the examples from the city. Thank you. Thank you all the participants. Thank you all the speakers. Thank you so much. So we'll also share the PPTs. Thank you.
Yeah, we'll upload all the PPTs and recording on the CSE website.
Thank you so much. Thank you, sir. Thank you, everyone.
Thank you, everyone.
Thank you. All the best. Yeah.
Yeah, we are wrapping up the webinar. Thank you. Thank you.